Hi, I'm Charity Moore, and we're on a special assignment here with Health Talk, where we have guest Trish Smith. She is a 3-year cancer survivor. We have an opportunity to share your history, your story a little bit here. Most of the viewers probably know that we're good friends, so it's going to feel awkward to ask questions that I already know some of the answers to. But anyway, Trish, go ahead and tell us a little bit about yourself, about your background.
Well, I'm from Connorsville, and I have a husband named Joe, and he works at NSK in Liberty, and I have 2 children. Grant Smith is a sophomore here at Connorsville High School, and my daughter Marley is a 7th grader.
Can you tell us a little bit about the history that your family has with cancer?
Well, my mother was diagnosed with ovarian cancer, and she has been gone now 13 years, so quite a long time. And then my stepmother, Margaret Knight, was diagnosed with breast cancer, and she's been gone about 15 years.
Has it really?
So, yeah, so cancer has been, up front and personal in my life, and it's a hard thing to go through. Any family, anybody that's been touched by it, it's, for cancer, it hit home to me.
What prompted you to do self-exams, or have you always done that?
When my mom was diagnosed, she had expressed to me how important it was to take care of myself, to do exams, to go to my annual exam appointment with my gynecologist. And of course, if you go there, they suggest the self-breast exams. I did do them on occasion, maybe not every 3 months or whatever that is recommended, but I would do them. And I happened to be doing a self-breast exam and had found a knot. I had just turned 40, and they recommend that a mammogram's done at 40. So I came to Fayette Regional Hospital, and I had my first mammogram.
So what was that experience like? Because you kind of had an idea something was going on, not sure.
I had come to the hospital. I was by myself, and I saw a technician who was wonderful. Try to calm my nerves a little bit because I was extremely nervous coming in. I thought it was going to really hurt badly. It wasn't too bad. So that was kind of nice, but the technician was reassuring she'd get me through, and when I finished, there was actually a physician on site the day that I did the mammogram, and he didn't feel like when he saw the results that it was looking quite right. So I went immediately across the hall, and we did an ultrasound. And when he saw the ultrasound, he said it didn't look quite right. Now the nerves are really hitting,
Right.
I'm starting to well up and thinking this isn't good. So at that point, the doctor recommended a biopsy.
So after you've done the biopsy, they've come back with a positive diagnosis, which isn't really positive. That's a hard thing to say. What was your next step with treatments? Did you start right away, or?
Well, when they did the diagnosis, the next step for me was to see if I was a gene carrier. If you are a gene carrier, you're 80% chance that you'll have cancer, and a greater chance of reoccurrence.
So tell me a little bit about the chemo treatment that you actually had here at Fayette Regional.
I had my chemo done here at Fayette Regional Hospital, and I came here once every 4 weeks, and I had 6 treatments that I did. And when I would come in, I would go to the cancer center, and they would hook me up on my IV. And what I especially liked here was the individual treatment that I received. I would come in and sit in my chair, and they would get me cozied in a warm blanket, and they would enter the IV and my family was even allowed to come in with me and help me pass time.
So having the convenience of the Cancer Care Center here probably helped too with perhaps the drive home, not feeling well, not wanting to be on the road.
Yes, definitely. I could leave here and be home in 5 minutes versus the drive after. It wears you out. You're not feeling very well. And when I was brought in and told what was going to happen, they had given me a book, and a nurse had come in and explained what the side effects could be, and meals to try to keep nutrition in me. And if there were ever questions, I could call and they would talk to me, or I could come in and the doctor would see me. So it made it so much more convenient to have it right here in my hometown.